Welcome to the Sunshine Training Center. For tips, how-tos, and videos on burn rehabilitation, subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. In burn rehabilitation, compression is one of the most effective ways to manage hand edema and guide scar remodeling. When applied correctly, Coban, a self-adhering elastic bandage, can help reduce swelling and achieve scar control. In this video, we'll demonstrate how to wrap the fingers and palm using Coban, with techniques that are both clinically safe and easy to apply in real-world settings. Whether you're new to burn therapy or looking to refine your wrapping technique, this step-by-step guide prepared by Shuhan Yang, Senior Occupational Therapist, will walk you through a practical, patient-centered approach. Let's look at what you will need. For wrapping the fingers and hand, you will need 1-inch and 2-inch self-adherent elastic bandage Coban, as well as scissors. We'll begin by using a 1-inch Coban to estimate the appropriate length needed for each finger. This measurement ensures you have enough material to complete a secure and consistent wrap. As a general rule of thumb, we recommend measuring about 4 to 5 times the length of the finger you're wrapping. You can go slightly beyond 4 times the finger's length. If your patient has swelling or if they have broader fingers, for example, many male patients, it's perfectly fine to go up to 5 times. On the other hand, if the fingers are slimmer, such as in pediatric patients, you can reduce the length accordingly. Keep in mind that even if your initial estimate isn't spot on, there's no need to worry. You can always add more Coban as needed during the wrap. Now, if your patient, like our demo model, has good hand mobility and can hold a relaxed position, you can simply let their hand rest comfortably as you begin the wrap. We will now demonstrate how to wrap the fingers. Let's begin with the index finger. Start from the middle of the fingernail and wrap downwards, towards the base of the finger. Starting in the middle of the fingernail keeps the fingertip exposed, which is important for monitoring circulation and skin color. To make the first loop look neat and secure, start from a diagonal angle along the fingertip. As you wrap, remember, do not stretch the Coban. Simply lay it down gently, allowing the material to adhere naturally. Each turn should overlap the previous one by approximately 1/2 to 2/3 of the width. Aim for a smooth, even pattern. There's no need to exceed this overlap. Once you've reached the base of the finger, gently press the wrap to help it adhere securely. Moving on to the middle finger. For the sake of demonstration, we are keeping the hand flat, so it's easier for you to see. However, in clinical practice, you may find it more effective to have the patient hold their hand upright. This position often makes it easier for the patient to maintain position and alignment, and it is also easier for the therapist to verify the wrapping condition, including the amount of overlap and the tension. Not all patients will have the same level of finger extension as our model, so feel free to adapt your approach depending on each individual's hand posture and flexibility. After wrapping, press the Coban lightly into place to secure it. It's important to always wrap from distal to proximal, starting from the fingertip and working toward the base. This direction helps promote venous return and manage edema by encouraging fluid to move away from the extremities. If you've measured too much wrap and have excess material, that's completely fine. Just trim it off. And if you're using gauze scissors, be sure to cut with the rounded tips facing down to avoid injuring the patient's skin. On the other hand, if you don't have enough material, just cut another strip of Coban and continue wrapping where you left off. Repeat this process for the remaining fingers. Always ensure that each fingernail remains visible and maintain consistent overlap. Trim off any excess material at the end. Now, let's move on to wrapping the thumb and palm. Compared to the other fingers, the thumb can be a bit more challenging to wrap. This is mainly because you'll reach the web space at the base of the thumb more quickly, making it slightly harder to navigate with the wrap. Moreover, since the base of the thumb is relatively thick, the material doesn't adhere easily, and it's also easy to underestimate the required length. Next, we'll begin wrapping the palm. For this, we'll switch to a 2-inch Coban to cover the larger surface area. If your patient's hand has no significant deformities, you can start wrapping from either the back of the hand or the palm. Both are generally acceptable. However, if the patient presents with a cupping hand deformity, it is strongly recommended to start wrapping from the palm side. Beginning from the palm allows you to gently apply tension in a way that encourages the hand to open up, helping to counteract the cupping posture caused by tight palmar scars. In contrast, starting from the dorsum can sometimes reinforce that inward pull, as the tension from the wrap may follow and unintentionally support the scar contraction pattern. So, in cases of cupping, starting the wrapping with the palm side gives you more control over the hand's contour and supports a more therapeutic extension alignment. In the absence of any deformity, the direction you choose can depend on what feels more natural or efficient to you. Many therapists find it easier to begin from the back of the hand, while wrapping from the palm side may take a bit more effort and control. Now, for the first loop, we usually start just beneath the fingers, overlapping slightly with the base of the digital wraps. From there, continue wrapping in a distal-to-proximal direction, with each layer overlapping by about 1/2 to 2/3. As you move around the hand, you might find that some areas, particularly near the web spaces, are difficult to see clearly. In these cases, gently tilt or rotate the patient's hand as needed. This gives you a better view and ensures the wrap is applied evenly and consistently. If you notice a gap forming around a finger or between wraps, you can pause briefly to adjust the placement before continuing. As you pull the Coban from the roll, use your free hand to press gently on the previous layer. This prevents earlier loops from being dragged or loosened as you go. Wrap up to the wrist. You can go slightly above the wrist crease if needed, depending on your clinical goal. Then secure the end. At this stage, the wrap may appear slightly puffy or bulky. That's completely normal. Simply press it down gently. The self-adhering material will conform nicely to the shape of the hand. Now, let's focus on the finger web spaces. These web spaces are common sites for hypertrophic scar formation. If left unaddressed, scar tissue can build up in these narrow areas and restrict finger abduction or independent movement. One thing to keep in mind is that when we wrap fingers and the palm using Coban, the inner web space area between the fingers often remain hollow, meaning they don't receive direct compression from the surrounding wraps. So, to apply pressure effectively in these spaces, we'll add targeted strips of Coban over the finger web spaces. Let's talk about sizing first. The length doesn't need to be exact. As a guide, we typically use a strip roughly equal to the length of one finger. You can cut these from leftover pieces or trim new ones. Just make sure they're long enough to stay in place without excessive tension. You'll need 3 strips of 1-inch Coban, 1 for the second, third, and fourth finger web spaces. We don't typically add one between the thumb and index finger here because the shape of that space requires a different approach, which we'll cover later. To apply the strip, place it gently over the web space. Pull slightly downward from dorsal to palmar to create light compression. Press the strip to secure it in place. There's no need for excessive stretch, just enough tension to achieve contact, and apply mild pressure. The goal here is to support scar remodeling and prevent hypertrophic scar buildup, while avoiding any additional friction or skin irritation. For the thumb, use a 1-finger length strip of 2-inch Coban and place it inside the first web space. And one important precaution: only apply pressure to intact skin. If the web space is very dry, thin, or showing signs of cracking or early breakdown, do not apply Coban directly. In those cases, place a layer of protective gauze in the web space first. Alternatively, if there are wounds between the fingers, you can use only gauze at first and wait until the wounds have healed before starting to use Coban. Then apply the Coban strip on top. This provides a buffer and reduces the risk of further skin damage during compression. By adding this step, we're ensuring that pressure therapy is targeted, safe, and adaptable, even in the most delicate areas of the hand. Now that the fingers and web spaces are wrapped, let's talk about an important follow-up step: preventing the wrapped fingers from sticking to each other. Coban is a self-adhering elastic bandage, which means that when 2 wrapped fingers come into contact, they may stick together slightly, especially during functional hand movements. This can cause unwanted friction, reduce finger independence, and in some cases, contribute to discomfort. To address this, we'll walk through 3 common methods for preventing finger-to-finger adhesion. Each method is simple, effective, and easy to integrate into your clinical routine. The first method, and often the easiest, is to use finger sleeves, also known as tubular mesh covers. To prevent sticking, you only need to apply sleeves to the index finger and the ring finger. Why those 2? Because once the index finger is covered, it won't stick to the adjacent thumb or middle finger, and when the ring finger is covered, it won't stick to the middle finger or pinky. By covering just those 2 fingers, you effectively prevent all 5 digits from adhering to one another. This method is reusable, low maintenance, and especially helpful during longer treatment sessions. When applying the sleeve, gently stretch the material open with your fingers, then slide it over the wrapped finger. Avoid pushing the sleeve straight down without expanding it first, as this may cause the underlying Coban wrap to bunch or shift, compromising your work. The second option is medical tape, like 3M tape. Just about any medical tape will work. Here's how to apply it. Tear or cut a short strip of tape. Place it between the wrapped fingers, positioning it vertically along the side of the finger or diagonally. The goal is to create a light barrier, not tight fixation. This prevents the fingers from making direct contact and reduces the risk of them pulling on one another as the hand moves. Tape is also a reusable method. You can remove it when needed and apply it again without affecting the Coban underneath. The third method is only used when you're done with the current Coban application and don't plan to reuse the bandages. In this case, you can apply a small amount of lotion between the wrapped fingers. The lotion neutralizes the self-adhering surface of the Coban so that the wraps no longer stick to each other. But keep in mind that this method is not reversible. Once the Coban tape is coated with lotion, it can't be reused for future sessions. Its adhesive properties are permanently lost. That makes this technique most suitable for final applications before scheduled rewrapping or single-use cases. Each of these 3 methods serves the same purpose: preserving mobility and maintaining the effectiveness of your wrapping work. You can choose the method that best fits your treatment plan and the needs of your patient. Remember, a small step like this can make a big difference in comfort and outcome. Now that we've completed the finger and palm wrapping, let's go over a few important clinical steps and reminders before concluding this part of the treatment. Remember that Coban is used for pressure therapy, not as a substitute for dressing. So if there are any open wounds, fragile areas, or active healing sites, make sure you've completed all necessary dressing procedures first, such as applying ointments, gauze, or protective layers, before you begin wrapping with Coban. If the skin is particularly delicate or sensitive, you may also want to use a thin layer of gauze as a buffer under the Coban. This helps reduce friction and adds comfort without compromising compression. It's important to remember that we never apply gauze on top of the Coban. Dressing and protection always come first, then compression. Let's briefly review the full sequence. Start at the fingertips, wrapping from distal to proximal. Leave about half of the nail bed visible to allow monitoring of circulation and skin color. Each wrap should overlap by 1/2 to 2/3. Wrap all 5 fingers individually. Then proceed to wrap the palm using a 2-inch Coban. When wrapping the palm, if the hand has no deformity, you can wrap from either side. But if the patient has a cupping hand posture, be sure to start from the palm to encourage extension and prevent reinforcing the flexed position. For teaching purposes, we've demonstrated everything with the hand resting flat, but in actual practice, it's often better to position the hand upright while wrapping. This allows you to continuously check your overlap and alignment and helps ensure no skin is left exposed. Once the fingers and palm are wrapped, you'll add the finger web pressure strips. These should be about the length of a finger or slightly longer, depending on what fits securely and comfortably. One key point: throughout the entire wrapping process, we do not apply tension to the Coban. We let it lay down naturally, with the only exception being the web space strips, which are gently stretched downward to create focused compression. Because these strips apply downward pressure, you must ensure that the skin in the web spaces can tolerate the added force. If the skin appears cracked, dry, or overly fragile, you should add a protective gauze layer before applying the strip. You can also choose to apply gauze first for protection, then place the Coban strip on top for compression. This creates a layered barrier that helps reduce friction and prevent skin breakdown, especially in patients who are prone to irritation. These clinical steps may seem small, but they are critical to ensuring the safety, comfort, and effectiveness of your compression therapy. Once the hand is fully wrapped, our job isn't quite done. Now it's time to perform a systematic check to ensure the wrap is safe, effective, and well tolerated by the patient. Let's walk through what to look for. Start by observing the fingertips. They should remain visible, at least half of the nail bed exposed. Normal in color, not too pale, blue, or dusky. Symmetrical compared to the opposite hand, if available. If the other hand is uninjured, use it for comparison. But if both hands are affected, check the skin color on adjacent areas, such as the forearm or palm, to detect any abnormal discoloration. Watch out for signs of venous congestion, such as a purplish or bluish hue at the fingertips, swelling, or a mushrooming appearance near the ends of the fingers. This kind of swelling can happen if the wrap is too tight or if compression is uneven. If you're unsure, gently lift the edge of the wrap and check for any pressure marks or indentations. If no marks are present and the skin rebounds well, it's likely within a safe range. Next, touch the wrapped fingers to assess their temperature. They should feel warm and consistent with the rest of the hand. Coolness may indicate compromised circulation. Also, gently press on the fingertips and watch how quickly the color returns. Capillary refill time should be less than 2 seconds. In addition, check with the patient. Do they feel any unusual tightness, tingling, numbness, or discomfort? Their subjective feedback is a key part of ensuring the wrap is not impairing circulation or nerve function. It's essential to remember that some complications from compression therapy don't appear immediately after application. That's why we recommend performing a second check at around 10 to 30 minutes post-application, especially for patients new to Coban wrapping or those with fragile tissue and circulatory concerns. You can also assess again at any appropriate intervals during wear, particularly if the patient reports discomfort or if the hand's condition changes over time. Keep in mind that throughout the day, factors like movement, swelling, or limb position can all affect how the wrap interacts with the underlying tissues. So repeated assessment, even after a seemingly perfect application, is an important part of safe and responsible care. This monitoring step adds just a few minutes to your workflow, but it can significantly reduce the risk of complications and improve patient comfort. Before applying Coban or any compression material, it's critical to ensure that it's safe and appropriate for your patient. Let's go over the key contraindications, as well as some clinical red flags that should prompt caution or consultation. There are several situations where Coban should not be used for compression therapy. First, recent skin graft or flap surgery. If the patient has had a skin graft or flap reconstruction in the past 2 weeks, avoid applying Coban to the affected area. Compression during early postoperative healing can jeopardize graft take or flap viability. Second, compartment syndrome. In any case of known or suspected compartment syndrome, compression must be strictly avoided. Additional pressure could worsen the condition and lead to severe tissue damage. Third, arterial insufficiency. If the patient shows signs of poor arterial blood flow, such as cold extremities, pale or bluish skin, weak pulses, or delayed capillary refill, compression may further impair circulation and cause ischemic injury. Fourth, exposed deep structures. Do not apply Coban over areas where critical anatomical structures are exposed, such as tendons, bones, joints, or deep tissue layers. These sites require protective coverage first and may not tolerate direct pressure. Even if none of the absolute contraindications apply, you should still pause and evaluate if you notice any of the following. The hand or fingers are already deeply discolored, even without any wrapping. There are active infections, open wounds, or unusual skin changes that haven't been assessed. You observe unusual firmness, swelling, or unequal skin tone that could indicate vascular compromise. In any of these cases, hold off on wrapping and consult with a physician or specialist before proceeding. When in doubt, it's always safer to pause and confirm. Compression therapy is an incredibly valuable tool in burn rehabilitation, but only when applied under the right conditions. By staying alert to contraindications and subtle warning signs, you'll ensure that your treatment remains safe, therapeutic, and well-tolerated by the patient. As we wrap up, no pun intended, let's go over how to safely remove Coban and perform a final evaluation of the hand. This step is just as important as application, especially if you plan to reuse the material or assess the skin beneath. To preserve the integrity of the wrap, particularly if reuse is intended, remove the Coban gently and in layers, unrolling or lifting each section gradually. Avoid pulling or tearing the wrap off in one motion. Doing so can cause friction or disturb healing tissue and may stretch the Coban, making it unsuitable for future use. If the patient reports discomfort during removal, go slowly and use blunt tip scissors when needed, especially near sensitive areas like the web spaces or joints. After removal, take a moment to examine a few key areas. First, the edges of the fingers and palm. Check for any indentation lines or pressure marks, especially at the beginning and end points of the wrap. Mild impressions are normal and typically resolve within 10 to 15 minutes. Second, overall skin texture. You may notice temporary wrinkles or creases from the compression. These are also expected, especially when Coban is applied directly to the skin without an underlayer of gauze. Third, signs of overcompression. Watch for unusually deep indentations, areas of pallor or redness that don't fade quickly, or localized swelling above or below the wrapped area. These may indicate pressure points that were too tight and should be adjusted in future applications. Fourth, shape of the fingers. The fingertip should retain its normal contour. If you see a mushrooming or bulbous shape, that may be a sign that the wrap was too tight distally and circulation was compromised. If the Coban was kept clean, without contact with wounds, bodily fluids, or excessive sweat, and if it hasn't lost its elasticity, it may be reused for the same patient. However, if the material is visibly soiled, you applied lotion to reduce adhesion, or the wrap has stretched out of shape, Then it's best to discard and use a fresh roll for the next session. Remember, patient safety and hygiene always take priority over material conservation. And with that, you've completed the full process of applying, monitoring, and safely removing Coban wraps as part of a pressure therapy program for hand edema and scar management. You can also check out our other video in which we demonstrate how to use the wrap fingers in a similar manner as an edema control method when Coban is not available. If you'd like to dive deeper into the rehabilitation management of hand burns, including how to use pressure therapy effectively throughout different stages of recovery, we invite you to explore our online courses. You'll find practical, evidence-based content designed for therapists who want to advance their skills in burn care and hand therapy. You can find more information on our website or in the link provided below. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation-related tips and videos, and visit our website for news about our latest training programs.